Hi, and welcome back to 10 Kids, 2 Docs, Parenting Insights from Pediatrician Moms. I'm Dr. Sylvia Bank.
And I'm Dr. Vivian Carlin. Welcome back.
We are going to discuss a teenage topic today, specifically how to help our teens make good decisions.
Oh yeah, this is a good one. If only we had the elixir for, always making good decisions.
Yeah,
we could make a lot of money.
Right. This is our best guidance.
Our first pass guidance in helping them make decisions. All right, let's jump in.
Welcome to the 10 Kids, 2 Docs podcast. Seasoned pediatricians and longtime friends, Sylvia Bank and Vivian Carlin have counseled thousands of parents and are raising 4 and 6 kids, respectively. Join these doctor moms as they incorporate fun and their combined wisdom and experience to share parenting insights for anyone looking for practical and trustworthy guidance. Please note that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment from your doctor.
Okay, I want to preface this episode by saying that I think for the sake of keeping this concise and focused, we should put aside really risky decision-making at this point. Mm-hmm. That needs to be a dedicated episode in and of itself. So we're just going to talk more generally about decision-making in teenagers. And Sylvia, why don't you lead us off? Do you have any stories to tell?
Sure. The story I have today about this is actually a story about me when I was a teenager.
Oh, I do want to hear.
Okay, so I remember this very vividly. And as many of you know from a previous episode, my father passed away when I was 15 years old. So I was still at home. I was a teenager when my mom became a single parent. And it was a notable time for me then, because after my father was no longer in my life, I realized all of a sudden that I actually had difficulty making decisions.
Oh, that's interesting how that event led to that. And I do think it's of note, your father passed away suddenly.
Yes. So he was not sick. There was no prodrome. There was not a long diagnosis. It was one day he was alive and one day he wasn't, which is
so hard.
It was very hard. And I think as things settled from that, the first time I noticed that I had difficulty was actually when we would go out to eat. Like my father was always, he wasn't very forceful. He was very knowledgeable and offered a lot of suggestions. And I think I realized that when I would go out to eat and he wasn't there, that I actually didn't know how to decide what to order on a menu, which is very strange for a 16-year-old.
Yeah, to not be opinionated.
Yes, but then prior to that, I think my dad would always suggest what I should order, and then I would just order it. Like it was never a process that I went through.
Yeah.
And I think that was like the first inkling of, I struggle with this. Like I can't even choose what to order on a menu.
Yeah.
And then that extrapolated even further, as I went through high school and the big decisions that take place with, where you're going to apply to college and how to decide which college you're going to. Like those bigger decisions, I found difficulty in doing that because I was not practiced prior to that. And I think with my situation, it was very specific because I think if my father were still in my life, I still wouldn't have made those decisions, right?
Yeah,
he would have suggested enough or helped me enough with that decision-making that I wouldn't have even noticed that I couldn't do it.
This makes me want to ask you a question. I know you're very self-analytical. Do you think there was a component of that was a reaction to grieving? That part of your grieving was that you were not capable of making decisions? Or do you think this is intrinsically who you were the whole time?
I think it was intrinsically who I was the whole time because it was I analyzed myself after I realized I couldn't make decisions and realized the cause was the fact that he used to decide for me.
Okay, interesting. I can relate to this in a lot of ways because I have historically been very indecisive. And what it makes me think of is I remember in 11th grade, I had a quote unquote friend who I had dated a little bit but I decided that we were just going to be friends, who wrote in my yearbook a very nice message that also contained the sentence, "Don't ever become decisive. It just wouldn't suit you." And I think that was actually meant as a little bit of a jab.
As a jilted ex-boyfriend.
Right. Because my indecision led to non-committalness. But that's as a side. I mean, it obviously was appropriate because that sentence has stuck with me for decades now. I still remember who it was that wrote that, but I won't give him a shout out. I appreciate the honesty. But when I analyze myself and my difficulty in making decisions, which was proven to me in my own self-analysis over time, I think it was because there was an anxiety around making the wrong decision.
Interesting.
But yours sounds different.
Yes.
It was more like you had come to have a reliance on your father's opinions and then realized as a teen you just didn't know how to formulate your own.
Yes. It's funny that we've both had these experiences in our high school years that point to how we made decisions or struggled with making decisions at that time, right?
Yeah. So I feel like this is a really interesting segue into how we advise our teens, because you and I are both describing a difficulty making decisions that probably for both of us led to a lot of passivity in making decisions.
No, absolutely.
You were very willing to rely on your father's opinions. I was very willing to just not commit or to let a decision linger until there was only one choice left kind of thing. And I think just in general in life, we want to empower our teens to be very active decision makers. But the tricky part is if we can try to understand our teens and realize what barriers they face that keep them from being active decision makers, then it can help us even more guide them. Let me give you some examples. So obviously, we all know teens can be very impulsive.
Right.
So I think for some teens, their passive decision-making is due to impulsivity. Like I don't make a decision and then all of a sudden I just decide on the spot, right? It's not an active thought out decision. It was kind of passive based on impulsivity.
Passive and then rushed, right?
Yes, yeah. For me, I'm describing an underlying anxiety, right? That would lead to a passivity because I was afraid of making the wrong choice. You're describing more of a pattern that you fell into.
Right. And kind of like an inability to actually, how do I go about deciding? I've never been practiced. I'd never made the mistakes. Everything always worked out.
Yes.
So I was kind of naive to how do you even approach independent decision making?
Interesting.
Yes.
Okay. So, now we have this scenario that you found as a teenager, and you also happen to be, as we already know from other episodes, exceptionally self-analytical and ready to figure out how to solve the problem. So what did you do for yourself?
Well, it started with the menu.
Okay, yeah, going to a restaurant.
Right? I mean, it's a transient choice, right? Even if you order something bad, it's just one meal, right?
Okay.
So part of it was I'm bad at this. I need to get better at this. So, it was going through a process of I'm going to make some decisions. I'm going to start making decisions and seeing how this is done, kind of teaching myself at an older age how to make decisions. And so, it started with the menu and just kind of trying different things. And, I discovered that there are things that I had never ordered that I actually like. Having someone else decide for me limited me in what I tried in my scope. And I think it really opened my eyes to becoming a more independent, adult independent woman who felt confident in making decisions. I remember going through that process, right?
Yeah.
What about for you? Where do you think that changed for you as far as making decisions?
Well, honestly, Sylvia, I'm not sure it has changed for me. I think in retrospect, I would have done very well at a school that had uniforms. I would have liked to have been freed of the decision of deciding what to wear. But I can be, once a decision is made, I knew about myself. I'm very, very committed.
Right.
But it was very difficult for me to make decisions. And honestly, as I counsel my teens and now some young adults, I sympathize with them that this was not a season in life that was my favorite because there were so many weighty decisions. And I still don't even really like that to this day. And honestly, I'll make another parallel. At some point, maybe we should do an episode on how we guide our teens towards thinking about future careers. But one of the reasons I think medicine is a very good fit for me is that when I go to work, I don't have to decide what I need to do to be productive.
Yeah.
I'm told, like,
Right.
here's your patient, here's the next patient, here's the next patient. And that model for a job works very well for me. Like, just tell me what to do and I can crank through it, right? But if I had to have a lot of thought put into how I'm going to use my time every day to make it productive, that's a little more stressful for me because I don't like making those decisions.
Interesting.
Yeah.
I find it, we've been friends for a very long time, like a lot of listeners know. And this is a similarity that you and I have. You and I are surprisingly similar.
Okay, I totally didn't realize this. So let's spend the second half talking about just practical advice for ways that parents can advise their teens, just to the tip of the iceberg on how to encourage a transition from passive decision making to active decision making.
Right.
Okay, so Sylvia, I know you've told me you have a talk that you give to teenagers in the office that I want to hear because maybe I will take it on as a talk I give too.
Right. Like, I like to point out the difference between passive and active decision making, which you did. Like, a lot of teens will be inhibited for some reason, like they don't feel like doing the work, they don't want to think about it, they're nervous about making the wrong decision, and they'll kind of just procrastinate. I think that's what it looks like from the parental perspective.
Yes,
like they're just procrastinating to make the decision. And then eventually, like you said, they're pushed up against a wall, the time has run out, and then they either impulsively make something or randomly make a decision.
Right.
And that type of passivity, or they kind of just, the decision just like fizzles and then their opportunity is gone even.
Yes. In other words, it's multifactorial what could lead to the passivity. It could be anxiety. It could be procrastination.
Right.
It could be just everything is done impulsively. But in the end, it all results in a passive decision-making process.
And then I try to, like, in the office, kind of point out the difference to teens about passive and active decision-making.
Yeah.
A lot of them don't even have that insight that that's what they're doing. So labeling it and pointing it out, I think, is the first step.
Yeah, I actually think you and I are more familiar with these terms because as I think back on medicine historically, I feel like really just before we started training, there was this push in medicine to make sure that we are allowing our patients to have active decision making, right? This part of our training was like how you present to patients their options. You give them enough information for them to be able to make a decision with you about what the best course of treatment is. And that was really a new push in the era of us being physicians.
Yes, absolutely. I mean, classically, medicine was the doctor says, take 2 of these and call me in the morning.
Yeah.
You don't even know what these are. You're just taking them very passively, right?
Yes.
So, the active, what is this? What does it do? Why am I taking it? And it helps, I think, overall with patient care because there's more commitment and the compliance is better.
Which is all things that we say about teens, right? If we can get them to be actively making decisions and often joint decisions with us, there's more commitment and more compliance.
Right. So it applies there as well. So what I do is I challenge them to be active decision makers. And the context that I usually give this one is the talk that I give when they're going off to college, the college talk, where, a lot of teens experiment in college, with a lot of different things. This is a relatively safe setting.
Yeah.
They can try different things on for size. Sometimes they try different personalities on for size, different friend groups, different coursework and majors. Like, a lot of decision making is happening in college.
And of course, what we all as parents fear that they are trying on, which is drugs and alcohol,
right? And
the elephant in the room and sexual activity.
Right. So when I advise them, I keep it real. They're going to college. These things will be available to them. And I tell them that as they're getting ready to go out or whatever, that when they're looking at themselves in the mirror, like eye contact, look at yourself in the mirror and make some decisions for the night. Like, you don't know what's going to happen, who's going to be there, who you're going to meet, what the setting is going to be.
Yeah.
But for you yourself, like, set personal goals for yourself, looking at yourself in the mirror. Like, maybe I decide I'm not going to drink tonight. Or maybe I have to study for a test tomorrow, so I'm going to leave at 11 o'clock. Premeditate some sort of higher thought. Or, the last time I tried this, it didn't go well. I'm not going to do it again today. whatever it is.
Right.
That
Or maybe it's even, when I'm offered a drink, I will take one and I'm not going to go beyond that.
Right. So some sort of premeditated decision for the evening with full knowledge that things might change, but that's to start them off. You have actively thought about what you might want to do.
Yeah.
And then that helps, hopefully, for teens, guide them in executing their evening, maybe the way that they had premeditated, and maybe they make some other decisions, and then that process is reevaluated for next time.
Right. Okay, there's a couple of things I really love about this. First off, we know for triggering our own memories, if you visualize something, it will bring to memory what you're trying to remember. So in other words, you've now instructed them, when you look in the mirror, I want you to do this. So I would guess that the next time they look in the mirror, hopefully they hear your words, right? Because you've now made an association of the mirror and this recommendation that you're giving them. So that is really cool. The second thing I like about this is that, as we know with teens, the amygdala develops earlier. So that is responsible for those quick, immediate reactions. It's more emotional and reactive. The frontal cortex develops more slowly, right? Which controls reasoning and is more thoughtful and logical. And knowing that, it's very reasonable to put a system in place for yourself to overcome that deficit of frontal cortex.
Right.
And to take that a little bit further, what it makes me think of is that we have great resources and writings now of adults who have either self-diagnosed or been diagnosed as autism spectrum, who recognize these deficiencies that they have, often in social interactions or in emotional reactions, who will report how they make themselves a list of ways to respond, and that works well for them. Like, they're in a different setting, they're overcoming this difference in how their brain processes by having a very logical list. And this is very similar. It's like we're overcoming the way your brain is processing right now, because that frontal cortex isn't entirely developed, by having this very systematic, when you look in the mirror, you're going to think through. It's almost forcing that active decision making, which will not come naturally to you necessarily. Yeah, I really love that.
The other thing I do is, sure, you might change your mind, or, maybe you don't execute it the way you thought you would. To give them that permission of, you don't have to be perfect at this. I don't want you to be anxious about making the wrong decision. I just want you to have some thoughts. There should be a little bit more understanding that mistakes are going to be made, hopefully not big ones. And then you learn from that decision making to apply to next time.
Oh yeah, I totally see.
Right?
Yes. It's like learning any new skill. It's going to take practice.
Right. And then to give them the grace of saying, it's okay.
Well, most of the time it's okay. Don't make any crazy decisions.
Right. But to not put so much weight in the active decision-making process. It's a practice, right? And then you start practicing it and then adjusting and seeing how it goes. So that's kind of what I recommend. I don't get a lot of feedback because we end our well visits at 18 years. So I never get to see them back to see if this advice is actually any good. But I feel very reassured by you that it kind of fits logical sense as to why this method may be effective. Right?
Yeah. I think it's something I will say to my own teenagers, actually. I love that idea.
Do you have any stories or suggestions
for
what you do?
So I feel like, particularly with this day and age, my first piece of advice in active decision-making with teens is to somehow take out the noise. And this is really applicable to more larger decisions, like you mentioned, what college to go to, or when they're considering professions, or whatever it is. And by that, I would say, find a time to just be by yourself thinking through how you feel about this. In my household, I would say to my children, pray about it, right? Have the phone down, everything off. All of your friends that are on that phone with all of their opinions and all of the noise, all of the social media, everything else, all of it put away, and have a regular time that is just you meditating, it would be another word for it, praying about how you feel led in this decision. I think that's applicable to everyone, that taking out all of the noise, because there's going to be so many opinions out there on any decisions that you're making, and just really allowing yourself time to sort of think, which way are you leading? Because sometimes our decisions can't really be summarized just in a pro-con list. There's intangible reasons why, where there's just this one is right and this one isn't. I like to get them thinking about that pattern of how to make a decision in this day and age of so many opinions out there that they're being bombarded with, to really set aside time to just be alone with their own thoughts.
Yeah. I mean, I kind of see that in the words when people are like, what does your gut say? Those types of non-tangible, non-descriptive ways of making decisions too, right?
Yeah. And I think the temptation to continuously be sitting with your phone in your hand, scrolling mindlessly through social media inhibits that really mindful taking into account what does your gut even feel?
Yeah.
Like, how do you even come to find how you feel if there's so much input of data all the time into your brain? Give your brain a rest and really allow yourself time to think about how you feel.
Yeah. Like in that vein, I also point my teenagers towards their sources. Like, who is advising you here? Do you think that they are good advice givers? And should you be listening to them, right?
Right. Another thing I do with my teens, we had mentioned earlier how sometimes it's really anxiety that prevents active decision making. And honestly, I do this for myself too. I have to play out in my own mind with difficult decisions. Okay, really, what is the worst case if I'm really feeling torn? And especially when there's an anxiety component, that principle in life in general of, all right, let's play out the worst case scenario and then talk about how we would mitigate that should it happen. Kind of frees up the brain from being so worried about making the wrong decision, because you realize that any decision is going to be fine.
Right. I like that.
Okay, this has been a really interesting discussion. I really enjoyed the stories and insight into your own self-analysis, Sylvia, as well as the talk that you give to teens. I definitely think I will adopt that. I think that's good for any parent to have in their toolbox. And when I summarize this episode, I think the gist is that we want to encourage our teens in active decision-making. We know that there are going to be barriers to them being good at that. The primary one being their brain development and that frontal cortex not being fully developed yet, which is really what controls reasoning and thoughtful and logical decision-making. But it can also be other things like we highlighted here. Some teens just with an incredible tendency towards impulsivity, some teens with a lot of anxiety that inhibits them from making decisions, and some, as in your case, who just have never practiced it and need to try to learn that skill for themselves. I do think this is really just the tip of the iceberg, but again, and that idea of just putting more tools in your toolbox in parenting teens and really having that discussion with them, that conversation, and encouraging them in this type of decision making.
Yeah, this has been a great discussion. This is 10 Kids, 2 Docs. I'm Dr. Sylvia Bank.
And I'm Dr. Vivian Carlin. We'll see you next time.
See you next time.
Thank you for listening to 10 Kids, 2 Docs, hosted and created by Sylvia Bank and Vivian Carlin. If you enjoyed this episode, please subscribe and recommend our podcast to other listeners. Visit our website at 10kids2docs.com, where you can find links to social media and leave comments or suggestions. Back next week with more topics in parenting.